I'll just get myself set up here. So, look, thank you very much for everybody, as Deirdre says, for coming along today. What I want to try to do today is just give a bit of an introduction, a sort of a very top level overview of acupuncture and what it's about, where it comes from, try and sort of demystify it a bit, because I know it can, people don't really can't find it hard to get their head around it and what it's about and what it might potentially be able to do. I'm going to talk about some of the modern research that there is now in relation to acupuncture for pain and for migraine and headaches, and how, what to expect if you were to go along to an acupuncturist, the type of things that you'd be asked and that they would look at and so on. So the idea is I'm going to start sort of going backwards and talk about where acupuncture came from and how it developed, because I think that's very important in terms of understanding its use and how it might be used these days. And then we'll get, as we move down further, we'll get into the more practical sides of possibly if people want to try it with migraine and how to find an acupuncturist, where to go to find somebody, and so on. So. Just a little bit about myself to give you a bit of background on me. I've been working, as Deirdre said, as an acupuncturist in Wicklow in Glen of the Downs for about 25 years. I've worked in different complementary clinics and a couple of GP clinics as well. And actually, I worked for a while in John O'Gall's Hospital in the Dublin County Stress Clinic there as well. Uh, I trained in Nanjing. Let me just see, can I get this going? Here we go. Yeah. So I trained for 3 years in Ireland. It's part-time. There's only part-time courses available to study acupuncture here. So I studied for 3 years, and I was taught by professors from Nanjing University of Traditional Chinese Medicine. Two fantastic lecturers I had who've huge experience and were very knowledgeable, and they were living in London at the time and used to fly over to give us lectures and tutorials and stuff like that. So we did the course over 3 years, and then at the end we did this visit over to Nanjing, where that's me on my bicycle cycling around Nanjing just before I got the grey hair. But we spent a short while over there. I worked in what was called the Nanjing Municipal Hospital, which is the whole experience was amazing. This was about 1999, pretty much before the internet and mobile phones and Google and all that sort of stuff. So we were wandering around Chinese. You just have it's very difficult to find your way around, and menus are illegible from our perspective and everything. So it was a sort of a fascinating thing. And the hospital that we worked in was just amazing. It was like I suppose it was a bit like the building looked a bit like St. Vincent's Hospital here. And when you walked in the door, you had all the board with all the departments on it, so that you'd have the modern medicine departments that we would know, like ENT, dermatology, gynecology, and so on. But then you also had the Department of Acupuncture, and you had the Department of Chinese Herbal Medicine. So the way it works over there in certain cities like Nanjing and Beijing in these hospitals is that the person who has an issue comes into the hospital, and they're sort of triaged in a similar way to what would happen here, I suppose. And they're sent to the ear, nose, and throat department, the gynecology department, or the acupuncture department, or the Chinese herbal medicine department. And we had a translator, Yan, you can see her here in the photograph in the left, who was an acupuncturist. And there were the beds on the picture on the right. You can see a couple of beds there. So there were actually about 5 beds, treatment couches, I should say, together. And the volume of people that we had each day was phenomenal. And the teaching there was brilliant. As I say, we were already qualified at that stage and had done all the theory, and this was a clinical practice thing, and we would have done lectures in a bit of specialty training and stuff like that. So that's just to give you a little bit about my sort of background and so on. So Before that, I worked in the pharmaceutical industry and the medical device industry, and I spent about 15 years working in that area I worked for 3M doing surgical and medical devices, and Sanofi doing pharmaceuticals, medicines, prescription drugs for doctors and so on. And that was a really useful thing for me to get a grounding in, because in each of the areas that we worked in, we would have had training, be it, if we were doing cardiac electrodes, we'd learn about that. If we were doing antibiotics for urinary tracts, we'd learn about that. So it was a fantastic training. But more so, I suppose, what it taught me is the value and the importance of evidence and evidence base and so on, and how, the difference between something being just, anecdotal or whatever, and something actually having clinical trials behind it to support it. And I mean, it was a fascinating sort of a business to be in. It's the the whole world, as you know, the pharmaceutical business is an amazing area, and has sort of developed a huge amount over the years and so on. So, and I've often thought that if you were able to sort of bottle and make it into a pill, and acupuncture, which you can't, of course, would be very attractive to the pharmaceutical companies, and they'd have a whole load of sales reps out on the road going around talking to doctors about this thing, because the world doesn't work like that. And therefore, as a result of that, it's sort of hard for the information about the effectiveness of acupuncture. It's hard for it to filter out, because we're individual acupuncturists working away in our own clinics, trying to get by and make a living. We're not able to go out and spend ages talking to doctors. Now, they do come across it through clinical trials and reading about it and so on, but it's much more slow, because there's no financial impetus behind it for drug companies to get out and promote it. So it's fantastic today to have the opportunity to talk to you guys about it. And who knows, maybe there's a medic or two in the audience or whatever, and it'll be great to sort of get the discussion going on it, I think. So, what is acupuncture and where does it come from? So, acupuncture is part of traditional Chinese medicine. And on the slide here, you can see the various elements of what we call TCM. You'll hear me talking about TCM all the time, traditional Chinese medicine. So you've got acupuncture needles, you've got Chinese herbal medicine, you have qigong or tai chi, cupping. You might have seen in the Olympics people with the red sort of marks and so on their backs and so on. Moxibustion is a form of treatment where herbs, are like a cigar type of a thing, is burned over areas to give a deep and penetrating heat into a particular area. And you have tuina, which is a form of massage, Chinese massage. So we're just concerning ourselves with acupuncture. I asked ChatGPT to do me a little drawing of the development of needles over the year. It didn't do a great job, but it'll give you the idea of what we're talking about. So originally, acupuncture started uh, roughly somewhere between 2 and 5,000 years ago. Now, it's really hard for us to get our heads around that, but I'm going to try to do that over the next 5 or 10 minutes. It probably started. Uh, the Chinese, if they didn't invent bows and arrows, they were very early adopters of using them, and there were territorial wars going on all around the place. So what most likely people think happened is that somebody in a fight or whatever will have got an arrow stuck in their hand, and they notice that their toothache miraculously improved, and it doesn't seem to be bothering them as much. Or they get a little arrow or something stuck in their leg below their knee, and notice that their tummy ache gets better, and that they're not suffering from that as much as before. So the original sort of development of it, going back 3 or 4 thousand years, probably developed, in my estimation, something along those lines. And they had stone needles originally, then bone, gold needles and today's modern needles. And I just, before we move on, I want to actually just show you what a modern acupuncture needle looks like, because people sometimes get a bit, fearful about, oh, is it needles, is it sore, and that sort of thing. And they're tiny. That picture is not a great one. I'm going to try to sort of show you with a little packet. They're all single-use, sterile, disposable needles, and so on. So what I want to do is just open one up here and take it out, and I'm going to touch it in a way that we wouldn't ever do when we're working, but just to give you the idea. So that's, if you can see. Uh, can you see that there? Yeah, able to see there. But when I press it like that, it's quite soft, if you can see that. Okay, right? So it's a tiny, hair-like or less thing. And it is, I'll just put that away carefully there. It's solid as well. So when you think of a hypodermic needle is obviously hollow because it has to inject the fluid through it into the body, whereas an acupuncture needle is solid and tiny. So it just has to part a little bit of sort of tissue to get in there. And consequently, it's much less painful. And when people are having acupuncture treatments, it usually is very not painful. Okay, so we'll talk about that a little bit more. So one of the earliest acupuncturists that was known is a guy who's nicknamed Wayfaring Magpie. And he was a traveling acupuncturist. And this, why I have this book cover up, is if you look carefully at the center of that, you'll see a little drawing, a depiction of this guy. It's a magpie with a needle. It's a big looking needle in his hand, treating somebody there with giving somebody acupuncture. Okay. And he is considered to be the sort of father of medicine, and he lived around about 2000 years ago. And he went around China giving people acupuncture and helping them with issues and pain and things like that that other people didn't seem to be able to help with. And that's why he became the first sort of famous acupuncturist. And he is sort of considered the elder, or the first sort of person in acupuncture, and revered in this stone carving on a wall, which is pretty interesting, I think. But anyway, later on, the stuff was written down, and obviously the Chinese, as you probably know, invented paper. And this is the first book that was written on acupuncture and traditional Chinese medicine, and it's called The Yellow Emperor's a Guide of Internal Medicine, Canon of Internal Medicine. And it was written as a sort of a discussion between what they call the Yellow Emperor at the time of China and his chief medical officer. And they were sort of discussing the whole theory of Chinese. It was the first book that was written, but there was still a tradition going back 1,000 or more years. So it was sort of updating that and putting it on paper. It was the first sort of book to put it on paper. And they looked at some absolutely amazing things for the time. So it was, as I say, a question and answer session, and some of the stuff that they would have asked for was like, why do people living in different regions in China suffer from different diseases? Like, why are those in damp areas getting certain diseases, and those in dry areas getting different type of diseases, and so on? And why are they living shorter lives than they did in the past? And all sorts of questions like that, including questions about headache and probably migraine, because they discuss it with nausea as well. So the answers were summed up, I suppose, that the chief medical officer replied that a lot of it was to do with overindulgence, irregular lifestyle, ignoring natural rhythms, and exhaustion as being the sort of principal causes of disease. So there's a hint in that, and in what the previous guy was doing. They were big, and the thinking was big in sort of getting in and treating lifestyle as an element of dealing with issues and so on. So it was, I suppose, preventative medicine at the time. But it, as I say, goes back 2,000 years, and specifically in relation to headache and migraine. He asked, when there's pain in the head, what is the cause? And the chief Chibo physician guy said, That pain results when yang qi, we'll talk about some of these terms in a little while, but it's basically energy and blood. When it can't ascend freely to the head and is obstructed by various things, they call it pathogenic forces. We'll talk about that. It could be like wind or damp or cold or whatever it is. Obviously, all of these things were written in the language of the time, and it sounds a bit bizarre and strange to us. But the process is actually, very identifiable and relatable in terms of what's now known about the causes of headache and migraine and so on. So they essentially said it was like a traffic flow problem, and that the energy just wasn't able to move freely, get up to the head, and move around in the way that it should do. So basically, what I'm sort of trying to illustrate here is that there's a really long history of this is just a picture, by the way, of from that book where it shows 2,000 years ago drawings of what they were talking about the large intestine. This is the heart channel on the left hand side, and channels in acupuncture. I'll talk a little bit about those later are on both sides. So you'd have the heart channel on the left arm and on the right arm. And as people will know, when somebody has angina, they often get a pain down the inside of the arm, exactly where the heart channel in this is flowing. But basically, what I'm saying is that there's a really long, uninterrupted history of acupuncture being used for pain conditions, for headache and migraine going back. And these are some, what I've put up here is just a little chart to sort of show you some of the landmark books that were written over the years on acupuncture and Chinese medicine. And like even just going back 1,000 years, there was a book called The Bronze Man, which was where the acupuncture points were sort of defined a little bit more clearly and so on. And that book discusses, acupuncture points at the side of the head that would be used when there's headache with nausea and so on. And the points that are used are still the same points that we would use in the clinic today for a lot of these conditions. So it's sort of, I think what you have to sort of try to do is get an understanding of this is one traditional line of history of acupuncture and its use going back a really, really long time, going back, to over 2,000 years at least. And also then think about the scale and the number of people who were using this. So China, the population in China, it used to be about 1,200 million. I think it might be 1,400 million or something like that now, but it's absolutely massive. And bear in mind that most of those people up to very recently would have lived in the countryside. And their form of, when something went wrong with them, where do you go to? This was it. It was going to the local acupuncturist and so on, and maybe a herbalist as well. And they would be getting treatments for all of the things. Our bodies haven't changed that much in 2,000 years. So there's still, the same conditions going back all the way then that they were treating and so on. So I think it's sort of important just to get our heads around the history and the number of treatments of something and the adjustment, the constant sort of refining and improving and arguments that would have gone on in these books saying, well, actually, no, that point doesn't work as well. I find when you use this other point that it works better and so on. And they'll, discuss that and figure it out and so on. And it's one sort of continuous long line of development of a practice going back over that length. And then when you sort of, it's sometimes we live in the modern world here, and we live in the world of the Beacon Hospital and Boots Pharmacy and so on. And when we live with the fantastic medicines and treatments that we have, and they are fantastic. And I was proud to work in the drug company when I did for the time I worked there. They had some great stuff. But we sort of sometimes need to get a little bit of perspective as well. I mean, when my dad is dead about 20 years now, but when he was born in 1921, there was nothing of that. What you see going on in the Beacon Hospital and Boots Pharmacy today, there was virtually none of that available. So he was born in 1921. There were no antibiotics at that stage, or little or nothing penicillin was 1928, but I think antibiotics didn't really come out till the 40s significantly. A lot of the painkillers were very basic opioids and things like that. So a lot of the all of the modern sort of medicine that we know of is really in that one lifetime of say me up to my dad's birth, if you like. And fantastic as it is, and it is, it's sort of interesting, just I think, to think of the idea that acupuncture has been developing during that same one life period. And I've already said, when you go back to the beginning of it, almost hardly any of ours is there. But if you go back another lifetime, acupuncture was developing, changing, improving, modifying. Go back another one, and the same thing all the way back. You can go back like 10 and you only get to halfway or a third of the way. You can go back 30 lifetimes to when that first book, the Neijing, was written. And that's sort of what I'm trying to get across. I know, this is a bit historic and not directly related, but it's to get that, that I think we need to have a little bit of respect for the numbers of people who have been treated successfully with this over history and who have found it useful for various sort of different things that were going on with them and so on. So having said all of that, I like research and I'm into research and I believe in it. And, numbers is one thing. It's a very good thing, I think, but you also need independent, verifiable research. So let's just have a look at acupuncture and sort of maybe how it works and at what level does it work. And sometimes it's difficult for people to understand, including doctors, I think, to sort of position acupuncture in terms of its sort of potential effectiveness. In the past, as I say, when I started about 25 years ago, there used to often be a sort of an attitude, yeah, well, sure, why don't you try a bit of acupuncture? You'll go into the treatment room and lie up on a couch and they'll play dolphin music and you'll relax there and it won't do you any harm type of thing. And that tended to be people's and I think some medics' attitude towards it over the years. And even doctors that I would have spoken to about it, family members who are doctors, would often have been quite skeptical about it. But there was one study that came out a little while ago, which I really like, and I sort of often try to think of, excuse me, in terms of trying to put this all into perspective about where it potentially fits into the whole thing. And it was a study that was published in the American Journal of Emergency Medicine, okay? And it looked at comparing IV morphine, which, as you know, intravenous morphine is a very strong treatment. And it looked at comparing IV morphine with acupuncture, okay? Now, you might sort of say, oh, well, that's not necessarily the fairest thing to do. But in fact, the reality is that actually it wasn't a huge study, and I'm not holding this up as the best study in the world. There were about 300 people in it. They gave 150 of them acupuncture and 150 of them IV morphine. These were people who were in moderate to severe pain, so quite significant pain. The reality is that the acupuncture people actually did better on pain relief. They got a 50% or more reduction in pain in 92% of the people who had acupuncture, and they got similar reduction in 82 of the people who had morphine. The other thing is that the acupuncture actually kicked in quicker than IV morphine. And as some of you may know, if you've had experience with it, IV morphine can have quite a bit of side effects and so on. So you can have issues with that, whereas there's very little with acupuncture. So look, I'm not saying that acupuncture is the bee's knees or will work for everything and so on, but it sort of definitely gave me a bit of a sense of where it can. And when when somebody comes along to me and asks me, do I think acupuncture might be able to help a bit? It's a study I often think of that, the potential for acupuncture to work is quite can be quite significant. So how acupuncture works, I want to go through a little bit to give you an idea. And it's really, the answer is it's not exactly known, okay? And you can look at it from a traditional Chinese medicine point of view, or they look at bits of it from a conventional medicine point of view, and they study blood and what changes happen and so on. So the theory behind acupuncture, according to the long history that I gave you, is sort of a bit summarized in this area. And uh, you see things like blood and fluids. We can understand that. We don't know what Jing and we don't know what Qi is, but I'm going to try and explain this as simply as I can so we don't get bogged down too much. But Jing is a substance that's a bit like our genetics. It's you know, am I somebody who can go out and party all night, or am I, after one night, one late night, am I wiped out for a week and so on? So it's that foundation energy, if you like. Qi is the energy that we have on a sort of a day-to-day basis flowing around with blood in the body. Shen is not so much a substance, it's more of a reflection of the other ones. So without getting bogged down in it, you have these things, according to Chinese medicine, moving around in the body, okay? And the easiest or the best way, I think, to try to think of it is just think of an imaginary house where you have a heating system with maybe a stove and a back boiler, heating radiators. You have your drains and your sink and your manhole covers and your electrical system with your lights and your electrical appliances and switches and so on, right? So in the house, you have all these systems which can be adjusted and regulated by thermostats, switches, valves, depending on what sort of fuel you put into your boiler and so on, okay? Now, we all know, with anybody who's owned a house knows that from time to time, the heating system will go out of balance, and you end up with a radiator up in the spare bedroom that's hopping off the wall, and your one down in the kitchen is freezing or tepid or whatever. So you get somebody in who knows what they're doing, and they what's called balance the radiator system. So a good plumber will know how to get in, and he'll diagnose the problem, and he'll say, well, I think it's that you've been burning damp wood and it's not getting up to system, or there's air in the system, or we need to change, adjust the flow, or that's and so on. So, and really, and also, the switches, the electric, he'll see if there's a circuit that's damaged or not allowing electricity to flow for one reason or another, or the bulb, there's a problem with it. So a plumber or an electrician can make these changes that effectively adjust flow, if you like, in the body. Okay. Now, what I would say is that acupuncture is sort of doing that in its own way. If you think of, a map of the London Underground with all the Piccadilly line and the Waterloo line, and think of that in terms of the body. Imagine that running across the body. This is what acupuncture theory says, that there's what I showed you earlier, there's this heart channel. And the points are like the stations that we hop on and off the train at, if you like, in London, and you can connect from one to another. You can also go in, according to acupuncture theory, and you can go into a particular point which we know affects. I talked about earlier this idea that there's a connection between a point maybe on my hand and this area, or my leg and my tummy and so on. So acupuncture can sort of go in. They're like access points, like drains or manholes or switches or thermostats or valves or whatever you want to call it. But you can get at that point on that channel in and influence the flow of the particular stuff that you're trying to influence, and you can up it, down it, or whatever. And that at a simple level is how I sort of try to get my head, because my head is very simple, around acupuncture, and that's the way I understand it. Okay, so and modern research, as I said, is looking at bits of how acupuncture works, and there are studies done on sort of blood flow. So that they've done what they call Doppler scans about blood flowing and impedance, or what can slow down blood flow, and they found that acupuncture can reduce that impedance, and obviously that can affect the way blood is flowing. That was done on the uterine artery. There's studies you can Google about that. Other points where a particular point will clearly, they'll show in MRI scans that it's setting off activity in different, like the visual cortex in the brain and stuff like that when the point is needle. They look at blood chemistry changes and they see changes in endorphins, cortisol, serotonin, measurable sort of repeatable changes that modern research likes to see, reproducible stuff. And that's all happening at a great pace. As I said earlier, there's a lack of funding for research because nobody can make money out of acupuncture. You can't patent it and sell it. So the research that comes is way too slow. But it is there and it is happening and it's coming along quite well. So how all this sort of relates to migraine and headaches, let's move on into that. So according to traditional Chinese medicine theory, headaches are caused by what they call a pattern of disharmony. So think about one of our systems here not functioning right. There's something not flowing properly and so on. And our job as an acupuncturist is to try to diagnose that in the same way as the plumber would and see, well, look, what bit of it isn't flowing around, or what's this person's constitutional type that's resulting in them getting migraine or headaches and so on. Okay. So they talk about patterns of disharmony, and these are just sort of like clusters of symptoms. But the very important point here to remember is that one condition like migraine or headaches can result from two or three different clusters of symptoms. And that's the important thing, because in order to use acupuncture effectively, we need to know what the root cause is according to TCM, traditional Chinese medicine, and go in and try to adjust that in the proper way, the way that the theory has developed, and do it. And that's the way that I'm going to talk about some clinical trials in a little bit as well. And that's the way that those trials were done. They were done on the basis of traditional Chinese medicine diagnosis and acupuncture points that then would be used to treat that particular, what they call pattern of disharmony. So how do we do that? When somebody comes along, we ask a whole load of questions. I usually email out a form and about a 4-page thing about all sorts of stuff, about, what color is your urine? What time of the day do you get tired? Do you get sinusitis? And it sort of looks at each of the different, in Chinese medicine, we look at what we call organ systems. So it's trying to establish what's going on with the lung energy, the kidney energy, the spleen energy, and so on. And when an acupuncturist talks to you, by the way, and says, oh, you have a deficiency in your spleen energy or something like that, it doesn't mean that there's something wrong with your spleen. This is a notional thing. What you're trying to do is say, in a normal person, the stomach or the liver or whatever would function at this level, and this is the type of result we would see from that, normal bowel movements, whatever it might be in the particular organ system that you're talking about. But in somebody where that energy is a bit off, you might see other symptoms and signs. They might get angry a bit or whatever it might be, and that will point us in the direction of that. But it doesn't mean that there's something wrong with their organ in that we're talking about. So a load of questions to help us home in on it. And then another area that we look at quite a lot is tongues, to try to sort of hone in on what it is. So I'm just going to give you 2 examples of, according to Chinese medicine, what might be at the background or behind somebody who has migraines. Okay, so they're going to be 2 if you like, causes according to Chinese medicine. One is qi deficiency and dampness. So that's like an energy deficiency or a sort of a slow metabolism. If you think of a sloth with sort of, couch potato, I can be a bit like that myself sometimes, with low energy and so on. And the other one would be a more, type A personality. We all remember Basil Fawlty in Fawlty Towers and so on. So the 2 sort of, I suppose, bodies that work in different ways, and each of those can result in migraine. So that the person who's the low energy type might, through the forms or when we talk to them, they might say, oh yeah, they're tired a lot, they get a dull headache, they're a bit heavy-headed, tends to be worse in the morning. They also have catarrh, sinusitis. They might have, like on the tongue on the right, a bit of a sticky, greasy coating on their tongue, maybe frequent urination, low appetite. I'll check their pulse, and the pulse will be what we call a weaker type pulse, probably. Their tongue will be pale, like the one on the left, generally. They might have clouded thinking. They could have, other things like swollen ankles or whatever. But there's a series of symptoms that will help me sort of say, oh yeah, that's what's going on here in this person, and that is why it's resulting in migraines. And they don't need to have all of those. A couple of them, and then the tongue and the pulse could be enough to give me a fair idea that that's what's going on. So then the other person is going to be the tongue, a bit more like the middle one. So that tongue, you can see there the two sides running right down the two sides of the tongue. It's a bit redder. The tongue in general is a little bit redder. And they might come with, headaches which tend to be a bit more one-sided at the temples, maybe throbbing, some visual disturbance. Their pulse will be wiry, according to Chinese medicine. They'll tend to get, a bit more irritable from time to time. They might be a bit moody or have low mood and stuff like that. So fine, the bit of type A, basal faulty type, hard to switch off. Now, these are complete stereotype extremes I'm talking about, but I'm just trying to give you an idea of how we do it. So the point here is we see one condition, headache, migraine, whatever it is, and there could be, 8 potential causes for it. And the important thing from us, from the point of view of acupuncture, is to figure out exactly which of those things it is. So I just want to move on a little bit because I'm just conscious of time and so on. There are some of the questions that we would be talking about. So let's move on and have a look at the research that there is now coming out behind migraine. It's all one thing to have this long use of it, but what do the trials say and so on. So the just to talk a bit about research. So at the bottom here, you have anecdotal evidence. This is a pyramid of the quality, if you like, of research and so on. So you have, the like the Chinese anecdotal evidence going back years and years, and people being treated and saying, yeah, I got on well, or I didn't get on well, or whatever it is. Then you have written up case reports and little studies, and then randomized control trials you will have heard of. And then moving up towards the very higher level, you have systematic reviews and Cochrane reviews and so on. And what we're talking about here is two Cochrane reviews on acupuncture, which were published in 2016. And they basically were amazing. So they found in the case of migraine, and these were big studies. There were 2,300 people in the migraine study, okay? And they found that after a course of acupuncture treatments, that 60% of the people had a reduction in migraine frequency of at least 50%, which is fantastic. And in tension headaches, 50% had similarly 50% reduction at least. Okay, so that is, that's based on a lot of people. Cochrane is a really high quality research organization, and that gives you the confidence to sort of sit up and listen. I think, it's all one thing for me to be waffling on about Chinese medicine going back 2,000 years and it's all great and blah, 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 blah. But, show me the money, show me the evidence. And now we're in a position after, well, certainly this wasn't around when I started off, but it is fantastic. So the conclusion in the migraine study was that the available evidence suggests that adding acupuncture to symptomatic treatment of attacks reduces the frequency of headaches. That's a very simple sentence, but it's a very important sentence from my point of view. And it went on to say that acupuncture may be at least similarly effective as treatment with prophylactic drugs. Which is also interesting. And they do what they call a plain English summary of these studies to just say it in plain English. And in both of them, they said that the available evidence suggests that a course of acupuncture consisting of at least 6 treatments can be a valuable option for people with migraine and tension type headaches. So that is where we're at in relation to that. Okay. So I sort of think 6 treatments is quite a small number of treatments, and in my experience, I would have found that quite often people will need more than that to get a result. So, I think, normally I would hope to see something after about 10 treatments if you're going to see it. And I can't stress enough that often you won't see an improvement. It's not a miracle thing. There are some people that it seems to be able to help, and there are others that it doesn't. But the statistics and the numbers, which I just showed you, are pretty good. So, other research in relation to pain, which I think is very interesting, was published in a journal called Pain, which is the big journal for that area. And what it showed was that in chronic pain, that the effects of a course of acupuncture seemed to last for a year after people had stopped the treatments, that they were holding on to about 90% of the benefits that they'd achieved during it, which is really interesting as well, I think, so um, in terms of, we'll wrap up now in a minute, and if there's any sort of questions or anything like that that anybody has, I'd be happy to answer if I can. Just to give you a couple of other thoughts on it. My first experience of it was actually, and this relates to that last point, my sister actually, while I was studying acupuncture 25 or 30 years ago, she used to suffer from really bad migraines, and I suggested to her, why not go to somebody, a qualified person, and get treatments. And she did that, and she was telling me, I was talking to her recently about it. She used to get migraines from age 7 to age 40. Okay. And at age 39, she went for acupuncture to this person that I'd recommended. And she went for a while, for probably about 6 months or so. And initially, there wasn't much improvement. In fact, I think she thought it got a bit worse in the first couple of weeks or whatever. But after a short while, uh, I think sorry, not a short while, after about 6 months, the migraines just stopped. And she actually hasn't had a migraine episode since then. So it shows the potential, I think. Now, people could argue it could have been something different or whatever, but it seems to be quite a thing that it seems to be able to affect it, and occasionally that can last. So I'm not making any claims or promises here or anything like that. I want to be very careful. I'm just trying to present the sort of evidence and a bit of my knowledge. My knowledge over the years is probably, to be fair, that it does take a little bit more time in terms of number of treatments and so on. And it helps some people. I'm absolutely sure it has definitely helped a good number of people that I've seen, and I know it probably hasn't helped others that I've seen as well. So I'm just trying to give you the honest sort of benefit of my experience. So in summary, I think it can be very effective for migraine and tension headaches. The research seems to be saying that. Our experience as acupuncturists is saying it. The first thing I want to say is here, where do you go when you want to talk to somebody or try out acupuncture? And these are the two societies that you should go to: the Acupuncture Council of Ireland and the Acupuncture Foundation Professional Society. You've got, I think there could be up to 1,000 qualified people who've all done the full proper training that you want somebody. You want somebody who's going to do the tongue pulse diagnosis and treat it according to that. As I say, that's what the studies that were done on the basis of. So we need to use the methods that were used in those trials if we want to try to replicate the results, the good sort of results that they've got. So a few quick questions before I finish up. Does it hurt? No, it doesn't. Occasionally, it's a bit like plucking an eyebrow or something like that. You usually lie there. It's usually about once a week, maybe twice a week. Think of, you need patience. Give it 8 or 10 weeks before you decide whether it's doing anything for you or not. Is it safe to use? Yes, it's safe to use if you're going to somebody who's properly qualified. There are very few people who can't have acupuncture, but what I would always say is that you do need to, your doctor is your primary health caregiver. You need to go to your doctor and talk to them. If somebody comes to me and they haven't seen a doctor for a while, I'm not going to treat them for something like that because I'm not a doctor. I can't diagnose So if there was something else going on, that wouldn't be the right thing to do. So talk to your doctor. A suggestion I would have is Google Cochrane acupuncture migraine and print off those things. And if you want to go in, maybe leave a copy in with your doctor a couple of days before your appointment and say, look, stick a post-it note on it and say, look, I want to come in and talk to you about this. They may not have heard of it. They may not be that familiar with it. It's easy for doctors to miss stuff that's in the clinical papers and so on. So that's the beauty of a day like this, and the Migraine Association, that it gives us the opportunity to try and get the message out there and open the discussion on it, and so on. So obviously, you all have the question, will it work for me? That's what everybody wants to know. I hope so. I really hope so. And I do think if you can afford it, unfortunately, it's not available on medical card. It is private, so you have to pay your 70 to 90 euros for it and so on. So should you try it, if you can afford it, and you know, it's not going to put you under too much pressure to try a number of treatments and have a bit of patience. Yeah, I think it is worth trying. As I say, talk to your doctor about it first. That's where you go to find somebody. So yeah, that's really, I think, about what I wanted to say. So.